European project People, Innovation for Societal Change, has been selected by the INTERREG IVC program. INTERREG IVC is part of the European Territorial Cooperation Objective of Structural Funds Policies, ERDF, for the period 2007 to 2013. It aims, by means of interregional cooperation, to improve the effectiveness of regional development policies and contribute to economic modernization and increase competitiveness of Europe. All this in the framework of the Lisbon Strategy, Innovation and Knowledge Economy. People Project responds to the INTERREG priority concerning employment, human capital, and education. People belongs to the modality of mini-programs. It comprises 7 European regions developing a combined framework for interregional cooperation and cover a 39-month execution period from the 1st of October 2008 to the 31st of December of 2011. The People total budget is €3,856,320 and the sub-project's total budget is about €1,750,000. People's general objective is to tackle demographic and social challenges actually faced by the European Union. The concerns of aging population, new family structures, legal and illegal immigration, and dual societies resulting in vulnerable groups will be tackled by means of innovation and technological development. The overall aim of People concentrates on 6 specific sub-objectives: reconciliation of work and private life, e-health and independence, silver economy, social and e-inclusion, social entrepreneurship, civil society empowerment. Each participating region is responsible of the management of one sub-objective, except the Timis County Council from Romania, which collaborates in all of them. The main activities taking place under People are related with the elaboration of regional action plans, regional communication campaigns during 2010, the European Year Against Poverty and Social Exclusion, international conferences, identification of good practices, the development of people information systems, including website and blog system, study visits for technicians and experts. INTERREG IVC, within the modality of mini-programs, offers the possibility for co-financing sub-projects. People will co-finance 10 sub-projects, and the Partners Fair will be the official launch of the People Call for sub-projects. According to recent Eurostat estimates, the working-age population will decrease by 40 million people from now until 2050, with an estimated decrease of 14 million youths between the ages of 15 and 24 in the same period. The birth rate in 2004 was at 1.5 offspring per woman, which is below the renovation threshold that is 2.1 offspring per woman, and with a projection that for 2030 the birth rate will be at 1.6 for the European Union. However, life expectancy, which from the 1960s has increased by 8 years, continues this tendency. European estimates project it will be 85.6 for women, and for men it will rise to 80.5 by 2050. This may create a larger proportion of people who find themselves in delicate situations. In fact, it is estimated that the dependency coefficient will rise to 51%. In 2004, 1.8 million people migrated to the European area, which could compensate certain effects, like low birth rates, but create other associated effects. As expressed through the communication of the Commission referring to the impact of aging population in the EU, for the first time in history, the first majority of European citizens are able to lead healthy and participative lives well into old age. At the same time, aging societies bring new opportunities to innovative firms through the demand for new or adapted goods and services. However, the combination of aging and low birth rates also poses major economic, budgetary, and social changes. Markedly, demographic trends are expected to transform our societies considerably, impinging on international solidarity and creating new demands on future generations. Such trends will have a significant impact on potential growth. European councils have recognized the need to tackle the impact of aging populations on the European social models. Policy change is broad, covering the ongoing debate on modernization of welfare systems and extending work lives as a follow-up to the Hampton Court Summit of October 2005, the renewed Lisbon Strategy. Healthcare systems in the EU are expected to face substantial challenges in the future. Public expenditure on healthcare is projected to grow by 1.5 percentage points of GDP in the EU by 2060. Healthier living can contribute to future spending. Healthcare spending is also strongly related to income growth and technological progress. Newly developed models for early diagnosis and treatments strongly contribute to growth in spending, but some of the medical progress may well be cost-saving in the long run. The first priority must be to implement the European Economic Recovery Plan so as to ensure that the financial crisis and recession will not put the EU permanently on a low growth path in terms of employment and labor productivity, which would also affect its capacity to cope with the consequences of population aging. Demographic renewal requires action to develop an overall social climate receptive to the needs of the family, a shift towards a children-friendly society, and creating conditions allowing a better work-life balance. It is believed that the 5 policy goals identified in October 2006 in the Commission's communication on the demographic future of European remain a valid long-term strategy. The goals were to promote demographic renewal in Europe by creating better conditions for families, promote employment in Europe with more jobs and longer working lives with better quality, make Europe more productive and dynamic, receive and integrate migrants in Europe, secure sustainable public finances in Europe, thus guaranteeing adequate social security and equity between generations. This should therefore be seen as a time for social innovation inspired by the successful experiences and reform projects already in evidence across the member states. Andalusia is one of the 17 autonomous communities of Spain and is located at the extreme southwest of the European community. With its 8,059,461 inhabitants, its extension of 87,597 square kilometers, and a population density of 93.6 inhabitants per square kilometer, Andalusia is the most populated region of Spain and second most extensive. The Andalusian working population is 69.10% and has a birth rate of 11.9. Life expectancy among men is 81 years, while with women it increases to 90.5 years. Its level of dependency is 45%, and the migratory rate is of 11%. The Junta de Andalucía, or Autonomous Regional Government, is the governing body in the region. It is made up of sector departments called ministries. The Ministry for Equality and Social Welfare, in connection with the General Direction of Social Services and Attention to Drug Dependency, front the project. As we already know, the concept of reconciliation is referred to the need for men and women to balance their interests, obligations, and needs from a holistic view of life and from their right to develop themselves in different areas: employment, family, society, and private life. The set of demographic changes, immigration, new family structures, the increasing elderly population, is threatening the European welfare state, so that regional governments should adjust their social, employment, and equality policies to the demographic and social changes in Europe. People Project aims to redefine a redistribution of time and build a new model of domestic coexistence in which men are involved at a maximum in their private life as women are doing in the public sphere. Thus, reconciliation will be conceived not only as a social good, but also at economic and personal level, since we cannot waste the human capital that women workers are providing to the society. The Southeast is